Hello, my name is Dr. Melissa Olashansky, and it is my honor to introduce Dr. Young, founder and medical director of the Rochester Center for Behavioral Medicine and the developer of Metrix. Dr. Young has been a leader in the field of psychiatry and behavioral health with a strong focus on improving diagnostic clarity, enhancing patient care, and integrating innovative tools that support clinicians in understanding the whole person. His work has helped shape more comprehensive approaches to assessment and treatment, emphasizing the importance of thoughtful diagnosis as the foundation for effective care. Dr. Young, in many areas of medicine, diagnosis is considered the cornerstone of effective treatment. From your perspective, how does the role of comprehensive assessment in psychiatry compare to other medical specialties, and what challenges do clinicians face in capturing the full complexity of a patient's experience in everyday outpatient practice?
Well, thank you. In every branch of medicine, diagnosis is the foundation of effective care. Cardiologists don't treat chest pain, they determine what's actually causing it. Lung doctors don't just treat wheezing, they identify the underlying disease before making treatment decisions. Psychiatry is no different. We have a highly sophisticated framework, diagnostic framework in the DSM, one that reflects the full complexity of human psychology. And yet, in everyday practice, we rely only on a small sliver of it. In many outpatient settings, assessments become synonymous with a handful of tools, most commonly the PHQ-9 and the GAD-7. These are valuable tools. They're effective, they're validated, and they're helpful for tracking symptoms over time, but they're limited. They focus primarily on depression and generalized anxiety, two important conditions, but far from the full picture. And when those become our primary lens, we risk missing what's really going on. OCD, ADHD, sleep disturbances, substance use disorders, psychological trauma, or more often, a combination of several of these disorders. This isn't a problem with the DSM, it's a problem with how we're using it. The DSM was designed to capture complexity, but if we're only screening for a limited number of conditions, we lose the nuance, and that impacts how we treat patients. Because patients aren't just symptoms, they're shaped by their experiences, their environment, their biology, their sleep, their stressors. Without that context, we're making decisions with an incomplete picture. The challenge, of course, is time. A truly comprehensive assessment done manually can take hours, and that's not really realistic in most outpatient settings. And that's exactly why we created Metrix. It allows patients to complete a structured, comprehensive assessment outside of the visit so that clinicians can gain a whole person understanding of the patient in front of them. Not just symptoms, but comorbidities, patterns, and context, clearly documented in the chart. So instead of asking, is this depression or is this anxiety, we can ask, what's actually driving this person's experience? And that shift changes everything. Metrix allows us to understand them well enough to help them.